My name is Dr. Rodney Foale, and I'm consultant cardiologist at HCA. I travelled to England from Australia in the early 70s and was lucky enough to work with some of the leaders in clinical cardiology at that time, both at the Hammersmith Hospital and the Royal London Hospital. I was intrigued by the deductive skills that they showed in assessing a patient with chest pain, heart failure, syndromes, palpitations, etc. In those early days, there was not quite the same arrangement of technology as we see today. But the deductive powers required to assess a patient's symptoms were greatly appealing to me. In addition to that, we were seeing the emergence of tools for treatment, which were clearly going to be successful and indeed have so proven to save lives. Not, of course, that other organs aren't equally as rewarding, but then cardiology was a very practical, subject with very interesting emphasis on assessing a patient's symptoms and then defining the next pathway. Very rewarding in as much that the symptoms that patients present with in chest pain or heart failure possibilities and often are quite life-threatening or life-changing. And finding out the basis of symptoms, if it turns out to be a valvular problem or a heart artery block or heart failure or important hypertension, all of which can very definitely limit life's quantity and quality, it's very rewarding selecting those patients who are going to benefit from the intervention, be it a pacemaker, coronary angioplasty, heart surgery of some sort. That's massively rewarding to see a patient at the end of the treatment returned and restored to full normal life and clinical activity and life expectancy indeed. I hope they can expect a friendly environment, tailored really to suit a patient's expectation in the private sector. The experience should be from the very front door to the reception, to my secretaries, and then into my consulting room, highest quality and comfort and ease and friendliness. And I've designed the pathway to really give patients as much confidence and comfort in my approach as I possibly can. When engaged in the consultation, I hope they can expect a sympathetic, experienced listener who will look at the holistic aspect of their presentation in addition to the possibility of a plumbing or electrical problem. And of course, once the history is taken, they can expect to be fully examined over a period of time when time is not really so much the essence as the experience of that patient, so that each patient will have as much time as they need to explain their symptoms and for me to arrive at a conclusion, a diagnostic conclusion. The next thing they can expect is that I will not undertake investigations that don't really provide both the patient and myself with a clear answer of what to do with that investigation. So my investigations are tailored to not only keep an eye on the expenses, but also to get value for money out of the safest and most appropriate test. And then finally, once the diagnosis is hopefully achieved, and if it's unfortunate that there is obviously an electrical or plumbing problem, I do have access and have closely trained with and have trained indeed some of the world experts in these fields. And we at Harley Street Clinic, particularly in this environment that I'm running here, have access to the world's best in terms of valve repair specialists, in terms of angioplasty, and in terms of electrical issues, as well as blood pressure treatment schedules. So I hope that will lead to, from the beginning and the end of the journey, to a very successful outcome for patients in terms of their symptoms. And that's my job, and that's the thing I enjoy most.